this video, I want to talk about a few common low back pain misconceptions. And the first one is that low back pain is a natural part of aging, and that's simply not true. So we know not 100% of people get low back pain when they get older, so it's not a natural part of aging, but yes, the research does say that more people tend to get low back pain as they get older. And the reason is that we stop moving and we stop giving our low back input as we get older. So when you're a child, you're running around on the playground, you're jumping, you're moving all around, you're using your low back and you're exploring every sort of movement. So you're just naturally doing that through play. As you get older, your window for exercise and your window for moving your spine gets smaller and smaller. So you go off to school and you start sitting more, and then you get a wife and kids, and then or wife, husband, and kids, and then you naturally start limiting that exercise. And before you know it, maybe you're running or biking or doing a small movement for 30 minutes without a warm-up, without a cool-down. And it's because we're not giving our spine enough input that people tend to have more pain as they get older. Another misconception is that bed rest is good after back pain, bed rest or complete rest, and that's not true. What we need to do is, within even the first 24 hours, start gradually moving. So start doing some easy movements through your hips, some very gentle movements through your low back, and start to get some things moving. When we have complete bed rest, it doesn't give enough input to your brain and to your mind about what's happening. So easy movement after a back injury is going to be most important, and that's going to help you get back faster. The bed rest approach, which is a very old theory, actually weakens you, and it's going to prolong how long it takes to get better. Another common misconception is that degenerative changes or osteoarthritis are the cause of your pain. What we now know from modern MRIs and modern imaging is that if your image says that you have degenerative changes or degenerative disc disease or osteoarthritis of the spinal canal, those are normal age-related changes. So those may cause stiffness and they may give a lack of input about what's happening from the muscle memory standpoint of the brain to muscle, but it's often not the cause of your pain. What we need to do in those instances is, one, get you moving better, and two, strengthen that area. So bring more resiliency to what's happening. But because we now know that many people who don't have any pain at all also have the same degenerative changes, we can't say that those changes are then the cause of your pain.